Now, a growing anxiety surrounding the Zika virus. It's made its way to the United States. Within the last 24 hours, 5 more U.S. residents have been diagnosed with the mosquito-borne virus. 2 in Illinois, 3 in Florida. On Friday, a baby born in Hawaii became the first in the U.S. with a birth defect linked to the Zika virus. 7th case has been reported in Texas. Right now, I'm joined by Dr. Devi with NYU's School of Medicine. Dr. Devi, good to see you. So people may be getting more and more nervous about this, and I think rightfully so. What exactly is the Zika?
So Zika by itself, it's a viral illness, and it's not necessarily that dangerous unless you're pregnant. I mean, most people who get it, they might have mild symptoms of a virus, so fever, rash, maybe some conjunctivitis or pink eye and some muscle aches. And even a large number of people don't have any symptoms at all. But the thing is, if you are pregnant, the problem is that it can infect the baby, and then it can cause severe brain damage potentially, and it could cause a miscarriage. So for women, pregnant women who are traveling to the affected countries in Latin America, they really should take precautions to protect themselves from mosquitoes.
True, but then now we're seeing what in Texas, California, and in Florida and Illinois. I mean, this is where it's been already detected, right? I mean, doctor, and we're talking about a wide swath of Central America and South America, Haiti. The question is, a lot of these folks, you know, that can have this come over here visiting, and is it possible for someone that comes from those countries that comes here could somehow transfer it over?
They can't transfer it over. It's really through the mosquitoes alone. But there are some issues. So, for example, the CDC issued some guidelines yesterday that, you know, women who are concerned about the Zika virus, who are pregnant, who have had this history of travel, or who have had these symptoms, should actually be offered further testing. Now, with the further testing, there are a few things. So you can get a blood test, but that's not actually done everywhere. So that's a potential issue. And the test is only effective for a couple weeks. So it's hard to tell if someone's actually had the infection or not. And then the second point is also that even for women who might have been exposed to Zika virus, it's not guaranteed that the baby would necessarily be affected. So some of the things that are offered at that point, they may not be as certain. So in terms of the ultrasound.
So let me ask you, so if you are a pregnant woman, and you do, you know, worry about it, in other words, is there a treatment for Zika if you have it and you're pregnant?
No, so that's actually the most concerning part. There's no vaccine and there's no specific treatment. So in terms of the test, it really depends what the mother's planning to do. I mean, if the mother's planning to continue with the pregnancy no matter what, there may not be as much of an advantage to having the test because, first of all, it might come back as a false positive, and second, it might cause a lot of anxiety and might not change your actual plan.
Dr. Devi, thank you very much for being with me. It's good to see you. I haven't seen you in a while.
Nice to see you, too.
Thanks. That wraps up this hour on MSNBC Live. Thank you for the privilege of your time.